Hello everybody, welcome back to my YouTube channel. This is going to be part of our longer series of videos. I've decided not to make one long video, but rather several short clips that people can just come back to at their leisure. So we'll start at the very beginning. It's a very good place to start. This video series is regarding methamphetamines and practice considerations for the anesthesia practitioner for methamphetamine substance use disorder patients. So what this means is if you have somebody who comes to the OR who needs either a procedure or surgery and you're not entirely sure what are the best medications to use, what are the best actions to take as an anesthesia provider, this video series will lay it out for you. My apologies, this will take about 1 hour of your time, which is again while I'm doing it in short little clips. So please come back to this YouTube page for the other videos as I post them. There is no CEU available for this. That is the part I apologize for as well. Hopefully in the future, this program will be available for everybody so that they can get some credit for watching this. But right now, you are here because you're curious what to do, and this should hopefully lay it out. So the very beginning is an introduction. And again, our practice considerations for methamphetamine substance use disorder. The objectives of this are to describe which medications are best used and which should be avoided when you have a methamphetamine substance use disorder patient who requires surgery. There are very specific considerations to take for the prurience. We will discuss those later also in this video series. And what are the risks of serotonin toxicity and rhabdomyolysis in patients who are methamphetamine users? So the funny thing about projects are you can't just know that it's an issue. I mean, we all kind of know as anesthesia providers that this is an issue. But you really have to nail down the specifics in order to say that this is important and people should care for it. One of the reasons that I started putting together this doctoral project to begin with is I was working out west. I was working in California. I was working in Arizona, and I had patients who were methamphetamine users, and it just felt like nobody exactly knew what to do. We weren't sure what to do about checking for amphetamines in the urine. We weren't sure what procedures we couldn't do. Should we do the procedure? Should we cancel? So forth and so on. I want you to know that this is not just an issue in the West. It's not just a problem for California or Arizona. Unfortunately, I wish that it was, but that is not the case. So first we're going to kind of go over very specifically why you should care about this, and from there we can move on and start talking about it. One thing I would like everybody to be aware of is that you'll see a lot of terminology out there surrounding substance use disorders and substance abuse, abusers, drug abusers. These are antiquated. And I know some people might be saying, why do I even care if I use the right terminology? You should care. But also saying that they're a user or an abuser, not only does it minimize that person, but it doesn't even give you a full picture of what's happening in the brain. And once we get into what happens to your brain, specifically when you use methamphetamine, although this can be said for some of the other substances as well, it really, you'll begin to see it as more of a pathological occurrence and like the surge and dearth, which kind of creates this cycle of use and seeking. And it's really not just about, oh, this person is responsible for their actions. It can kind of hijack the brain in ways that maybe sometimes we hadn't thought about prior. So making sure that you say substance use disorder is just kind of a way to shift your way of thinking that these patients should not be treated with negativity, but they need care, and a lot of times they need a lot of assistance to get out of that negative pattern. Moving on, in 2014, 21.5 million people were diagnosed with substance use disorder, and methamphetamine accounted for 1.6 million of those people. About 5.4% of people have reported using methamphetamine in the United States, and that has quadrupled over the last 6 years. However, this number is probably drastically underrepresented because it's not like people are going to say, yeah, I use methamphetamine. There's, like I said, a lot of stigma attached to this, especially because of its illicit nature. So the numbers are probably higher than what people are willing to report. Phoenix, and then there was another study out of Hawaii, showed that their population use is probably more close to 15% of the population, which seems high, seeing that 5.4 are reporting it, but really 15% of people are using. So the likelihood that you'll see a patient who comes into the OR who has used methamphetamines is more likely than I think we give it credit for. The cost of using methamphetamine was about $740 billion, and methamphetamine costs are about $16.2 to $48.3 billion of those dollars, and $11 billion is due to direct healthcare costs. Now, what that means is that $11 billion is what we spend for or on methamphetamine use disorder patients, whereas the other monies are usually like loss in productivity, loss of worker productivity, that kind of thing. The impact to the OR, methamphetamine hospitalizations have increased by 245%. Here's that study that I was mentioning prior. 15% of ED patients in Hawaii were testing positive, very similar to what was happening in Phoenix. And this should not be a surprise to a lot of my anesthesia providers, but there was a survey of about 5,000 patients, and of those 5,000 patients, it showed that 81% of patients provided false information to their providers, right? We see this all the time. Sometimes we ask a person, do you have any loose teeth? And they say no. And then you do a little dental exam and you get in there and it turns out that, yeah, they do have loose teeth, but they're embarrassed. The same thing with methamphetamine. They're embarrassed. There's an illicit nature. They don't really want to talk about it. So they're not going to really admit to you that they have used. And that, as we know, can be very dangerous in the OR. So my problem statement is that it's important for every anesthesia provider to understand the lethality of methamphetamine in patients who come into the OR. They can have hypertensive crisis, cardiovascular collapse, profound hypotension, and sometimes even death. And I think that this is a wonderful stopping point until we get on with the rest of the paper. So thank you. If you've made it through this 8 minutes, please don't feel like you've wasted your time. This is a very important introduction. Very important that we talk about these kind of things before we get into the meat and potatoes. However, please, like I said, come back to this YouTube channel, and then we will talk about more of the pharmacology, pharmacokinetics, and the really important stuff that every anesthesia provider loves to hear about. Thank you, and I'll see you again soon.